Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is Tuesday, November the 24th, 2020. We are in week 38 of the COVID-19 pandemic here in Montgomery County. And today I'm joined by my colleague, Commissioner Ken Lawrence. Since our November 18th press briefing, we have had a total of 1,733 new cases of COVID-19 reported in Montgomery County. This brings us to a total of 19,082 cases since the pandemic began, and you can see the daily breakdown on your screen. These positive cases are a result of a positive test for the virus, not from the antibody test. 46 of these are from long-term care facilities or other congregate settings. 1 is from the Montgomery County Correctional Facility. 2 are from Norristown State Hospital, and 1,684 are from the community. These positive individuals reside in all 62 Montgomery County municipalities. Today's individuals range in age from 11 days old to 110 years old. And as always, you can check our county map at montcopa.org/COVID-19 for updated geographic information. Today, we have 918 females, 809 males, and 6 unknown. I'm sorry to confirm that 7 additional Montgomery County residents have lost their life to COVID-19, which brings us to 864 deaths confirmed positive from COVID-19. 4 passed away in a hospital, 1 in a long-term care facility, and 2 at home. I'm sad to note that today the age range begins at age 34 and goes up to 100 years old. Also, although this individual did not reside in Montgomery County, I do want to acknowledge the death and extend our condolences to the family of a beloved school bus driver for one of our public school districts that passed away yesterday. Overall, we've lost 456 females and 408 males to this disease. The overall age range is 34 years old to 104 years old. In terms of self-reported racial breakdown, where we have it, we have 20 Asian, 3 Asian Indian, 3 Asian Korean, 107 African American or Black, 355 white, and 376 unknown. The fall surge in COVID-19 cases continues here in Montgomery County, across southeastern Pennsylvania, and across our Commonwealth. We remain in a period of rapidly escalating cases and hospitalizations, and sadly, we are beginning to see an increase in deaths. Our positivity rate continues to increase. Our 14-day average positivity rate is 8.17% as of Thursday, November the 19th, compared with 7.04% as of Friday, November 13th. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph, showing the daily positivity rates from November the 6th to November the 19th, shows that the county is now above 5% on each of those 14 days. Our hospitalizations continue to increase. Today, 270 individuals with COVID-19 are hospitalized in a Montgomery County hospital, an increase of 49 individuals from last Wednesday, and an increase of 135 individuals from just 2 weeks ago. 11% or 30 of these individuals are requiring a ventilator. As a reminder, both hospitalizations and deaths lag behind cases. So if our case numbers continue to rise, we will continue to see an increase in hospitalizations and sadly, eventually in deaths. We now have added the information on daily hospitalizations and ventilator use to our data hub at www.montcopa.org/COVID-19. And what you see on your screen now is a screenshot from that data hub information. I've been asked by the Montgomery County Board of Health to remind parents that the Montgomery County School COVID-19 Risk Reduction and Mitigation Order, as passed, allows schools to offer the educational methods they choose beginning on Monday, December the 7th. Resuming in-person education does not require any vote or other action by the Montgomery County Board of Health. Should the Board of Health feel it is necessary to change this order, a special meeting will be called for that purpose. No special meeting has been scheduled. The December 2nd meeting of the Montgomery County Board of Health is a regularly scheduled meeting, and this issue is not on the agenda. I want to reiterate that resuming in-person education on Monday, December the 7th does not require any vote or other action by the Montgomery County Board of Health. Everyone should be aware that yesterday, the Pennsylvania Department of Health and Pennsylvania Department of Education updated their recommendations for pre-K to 12 schools following identification of a case or cases of COVID-19. PADOH and Pennsylvania Department of Education recommend full remote learning model for all schools in counties with substantial level of community transition. Montgomery County is currently in the category of substantial transmission. For schools that choose to pursue in-person instruction or other models in which school buildings are utilized by students or staff, they are directed to follow these new recommendations. And again, if you want to take a look at what those are, the page or the document's called Recommendations for Pre-K to 12 Schools Following Identification of a Case of COVID-19. As we continue to navigate this very challenging situation, I want to remind everyone that it does appear that there will be at least 2 highly effective vaccines that will be available in limited quantities by the first of the year. The county's Office of Public Health and Department of Public Safety are deep into planning for vaccine distribution to the public once it becomes available. As we stare down this surge, keep this hopeful news in mind. There will be an end to this, but we have a number of months to get through before we can begin to return to our pre-COVID lives. Our goals for the next several months are to protect our hospitals and first responders. For those school boards across the county that vote to offer in-school education, keep our positivity rate and incidence rate of new cases as low as possible to minimize risk of students, teachers, support staff, and bus drivers in our schools. To continue to allow businesses that are operating safely, are following all mitigation measures, and that are not sites of COVID transmission to continue to operate. I hope that you share these goals because these goals will be extremely difficult to meet without cooperation from every person in this county. As we celebrate Thanksgiving this week, please keep the following facts in mind. The CDC has determined that over 50% of transmission of the coronavirus is by people with no symptoms. And I am going to repeat that. The CDC has determined that over 50% of transmission of the coronavirus is by people with no symptoms. The virus is transmitted predominantly by respiratory droplets generated when people cough, sneeze, sing, talk, or breathe. Multi-layer cloth masks that do not have a valve can block 50 to 70% of these respiratory droplets. Cloth masks do prevent transmission of the coronavirus. It is these facts that I hope you will take into consideration as you think about how you are going to celebrate Thanksgiving this year. All public health experts agree that no one should host an indoor Thanksgiving celebration with anyone outside of their household or family bubble. Our Office of Public Health has posted guidance and ideas about how to make this Thanksgiving still feel special at montcopa.org/Thanksgiving guidance. And you can see part of that guidance up on your screen now. Additionally, if you are able to work from home, please do so. This is a time to be back at home and working from home if it is at all possible for you to do that. Do not carpool unless you drive with the windows open and every person in the car has on a mask for the entire drive. Please limit your non-essential trips and travel. Don't leave home without a mask, and put it on whenever you're within 6 feet of someone who is not in your household, even if you're outdoors. Keep that 6 feet distance from anyone not in your household. Keep your hands clean and away from your face. Get tested if you need to or want to. Please cooperate with contact tracing and download the COVID Alert PA app. This free app can protect you and your family by letting you know that you may have been exposed to someone who's now tested positive for COVID-19 and alert you to seek medical attention and testing. This is particularly important now because as we have so many cases that we are trying to contact trace, we may not get to people who've been exposed as quickly as we would like to. So if you have that app, if everybody in our community here in the county had that app, it would go a long way to conferring protection in our community. This app also works in the state of New Jersey, the state of Delaware, and the state of New York. And so if you are traveling to those places for some reason, the app works there as well. Now, due to the large volume of cases, our contact tracing team is prioritizing contact tracing in the following ways. And this is under the guidance from the Pennsylvania Department of Health. Our individuals of highest priority are people that are 18 years old and younger, people that are 65 years of age and older, or persons who are part of a community or household cluster. Also, if you were exposed at school, through a sports team, or at your workplace, and you need to quarantine, your initial contact from the contact tracing team is now likely to be by email rather than a phone call. If you believe you've been exposed through one of these locations, please check your email regularly. Currently, the contact tracing team has 65 members, and we are continuing to add more as quickly as we can. We do continue to have good availability of testing, and I want to continue to urge anyone who wants or needs to be tested to get tested. We know that it's become a little difficult to get appointments, so starting Monday, November the 30th, we are expanding our testing site hours to be from 9 a.m. to 5 p.m. Monday through Friday at all 6 testing locations. Our hospitals have asked us to remind the community that hospital emergency rooms are not to be used for COVID testing. You are absolutely encouraged and welcome to go there if you are sick, but they are not to be used for routine testing. Please use a county testing site or any one of the many private sites in the county for this purpose. If you know that you've been exposed to COVID-19, you should self-quarantine for 14 days. If you would like to be tested, we recommend that you wait 5 to 7 days since the exposure. So let me just say that one more time. If you know you've been exposed to COVID-19, before you get tested, wait 5 to 7 days. If you get tested more quickly than that, the test will not be reliable. And even if you test negative at 5 to 7 days, at this point, you must complete that 14 days of quarantine. County sites will be closed on Thanksgiving Day, but will be open on the Friday after Thanksgiving. Just a couple reminders about our county testing sites. The sites don't require a car to be tested. They provide testing at no cost to you, but we will bill your insurance if you have it. We do not require that you have a healthcare provider's order, and we will test individuals of any age who want or need to be tested. The one thing we require is an appointment. Because the sites have been so busy, we can no longer accommodate people who walk up. So please do make an appointment. And as I said, starting on Monday, that should be much easier to get. All appointments are made on the day of testing, beginning at 8:30 in the morning. You cannot book ahead. We do require that the person being tested is a resident of Montgomery County, works in Montgomery County, or goes to school in Montgomery County. The locations are in Pottstown, Lansdale, Willow Grove, Green Lane, Ardmore, and Norristown. To register for a test online, go to montcopa.org/COVID-19 and click under the green County Testing Information button at the top of that page. Or you can register by phone, 610-970-2937. And again, both online and phone open at 8:30, not 8:29. So if you go online at 8:29, it's going to say that everything is closed. So you just want to get on right at 8:30. Also, a reminder that if you register by phone, we do have language line available and people can be assisted in the language in which they're most comfortable. For the 14-day period ending November the 19th, 51,136 Montgomery County residents were tested. So that is great. It's great to see that number continuing to go up. That number is an increase of 6,151 people tested compared with the 14-day period ending November 13th. All those people getting tested really helps us keep an eye on what is going on here in the county. And so before you see our date tested graph. As a reminder, those gray bars in the background are the number of tests done on that particular day on any Montgomery County resident. And then the various lines are the 7 and 14-day averages. So the darker of those blue and red lines is our 7-day average in the community. And then the lighter of those the darker of the two lines are the 7 and 14-day average of everyone. And then the lighter, the sort of light blue and pink lines are the 7-day and 14-day average of people who are just from the community. And you can see that it's almost the same as the total. Way down at the bottom, there are the averages from the long-term care facilities. And you can see that that continues to be just a very, very modest number of cases in our community. It appears that possibly these numbers of cases are starting to level off. I really hope that that is the case. We're obviously not going to know that for several more days. And we remain deeply concerned about Thanksgiving, given what we have seen in other holidays, as most recently Halloween. So again, please take all of this information into consideration as you make your choice, your family's choices on what you're going to do on Thanksgiving and over the weekend. Please make choices that are as safe as possible. We remain in a serious and rapidly evolving situation. And I know we can suppress this virus if we work together. We did it so successfully in the spring, as you could see on that chart that we just showed you. And we can absolutely do this again. But it takes all of us working together to make safe choices. We all need to acknowledge that many, many others are making sacrifices as well. And that just show a little compassion and kindness to everyone around you. This is a tough time for every single person in our community. And we just have to stand together, stand united in this fight, and we will get through this. So with that, I'll turn over to Commissioner Lawrence.
All right, thank you, Val. I am going to share again some of the mental health resources that we have available for citizens, for our friends, for our family, for our neighbors who need it. You know, as Val mentioned, we are in week 38 of this with social distancing. And I know that it's tough as we come up on Thanksgiving, where many people are making the decision just to celebrate with their family members and not seeing family members that they would typically see during this time. And many of us are experiencing a greater and greater sense of isolation. And on top of that, there's the fear of being infected. As we see, we have community spread now. There's still economic difficulties, restrictions, and inconsistent messaging about the virus. And when it may end, only adds to all of our concerns. But as Val mentioned, there is hope with some promising vaccines coming in the next few months. So while we're seeing a large spike in positive COVID-19 cases at the onset of the holiday season, we're hoping we can prevent a spike in mental health crises by continuing to provide resources that can help not only during the pandemic, but always. The Montco Department of Human Services and the Center for Community Resources is always here to help and has a statewide support and referral helpline, which is available 24/7. The mental health support line, Warm Line, can be reached toll-free at 855-284-2494. And Montgomery County Mobile Crisis Support is also available 24/7 for anyone who is experiencing depression and suicidal thoughts, and they also provide peer and teen support services. You can call 855-634-4673 toll-free, or visit www.accessservices.org for more information. This is also a good time to remember to stay in touch with friends and loved ones in the safest way possible, whether it's Zoom, FaceTime, Skype, or just a plain old phone call. Reach out to someone, especially this holiday weekend, and check in to see how they're doing. And I'm hearing that Zoom has unlimited Zooming this weekend for the holiday, so you can make it longer than 40 minutes. Let's also remember our seniors during this time. Our Office of Senior Services is here to provide seniors with the services they need during the pandemic. Our senior centers are providing virtual programming, which is open to any of our seniors in Montgomery County. Information about senior centers and their activities is available at www.montcopa.org/senior services. And the Office of Senior Services continues to take referrals for home care, but they are not doing face-to-face visits. All assessing and care management is by telephone, including our protective services. If you know of an older adult who may be abused or neglected, or you're concerned about their well-being, please call our protective services hotline at 1-800-734-2020. And that's 1-800-734-2020. Right now is also open enrollment for Medicare recipients. If you need help comparing plans and deciding which plan is best for you, free Medicare counseling is available by calling 610-834-1040, extension 120 for an appointment. And finally, this is Giving Tuesday. We haven't provided an update on our Montco PA COVID-19 response fund for a while, but the fund is still in existence and continues to raise money for the incredible need that still exists in safety net organizations throughout the county. The fund was established on March 26th and is administered by the Montgomery County Foundation. It is a community-wide effort to support the immediate needs of residents hardest hit by the pandemic. As of November 20th, nearly $900,000 has been raised or pledged for the fund. I'd like to thank all of our local foundations, businesses, and private citizens who have contributed, and we will continue to welcome new contributions, large or small. Over 250 local safety net organizations and first responders have been awarded almost $859,000 in response funds. Grants of up to $5,000 are being reviewed and processed on a rolling basis. Projects are prioritized based on the geography they serve, the capacity to meet the higher demand for services, and whether the projects target particularly vulnerable populations. Grantees so far include food pantries, senior care programs, rent and utility payment programs for low-income residents, behavioral health care and telehealth services, ambulance services, child care for healthcare workers, domestic violence services, protective personal equipment purchases for nonprofits, continuing essential in-person services, and emergency shelters. As the COVID-19 pandemic continues, funds are still needed to support the ongoing efforts of our first responders and social safety net providers who are dealing with the effects of COVID-19 and helping our most vulnerable citizens. If you are able to help support the need and high demand for grant requests by making a tax-deductible donation, you can find more information about the COVID-19 Response Fund at www.montcopa.org/COVID-19. Back to you, Val.
Great, thank you, Ken. Just a reminder that our next briefing will be next Wednesday, December the 2nd. We may have to slightly adjust the time, so just keep an eye out for that announcement. And with that, I'd be happy to take questions.
This afternoon, we're joined by Deanna Durante from NBC 10 and Joe Claviglia from the Bucks County Player Times. We will start our questions with Deanna Durante.
Todd, it's Savalia. Anyway, so hi, everybody. Happy Thanksgiving, early Thanksgiving. Couple questions for you. When contact tracers call you and ask you where you have been, when we keep hearing, especially on the state level, so many percent we're at a gym, so many percent we're at a restaurant, that is not saying, and correct me if I'm wrong, but I'm trying to understand this, that's not saying that they got it at the gym or the restaurant. It's just that they were there at some point when they could have been exposed before or in their life as they're trying to figure out where they've been to warn other people.
So that is mostly correct. Just because you've been to a place doesn't mean that you absolutely got it there. But then the contact tracers would then try to see if they could link your case, let's say you'd been to a particular location, to others that we also knew were positive that were at that location. And then that's how we would establish that there was a transmission at that location.
And we're not reporting how many have actually been transmitted at those locations?
No.
We don't have. Okay.
No. And the state,
Why is that?
I think the state is just reporting those aggregate numbers because people are wondering about those particular places. We have tried to share with you as much as we could as specific information we have here in the county. For instance, the last time I got the full report from my contact tracing team, I'm not aware that they had documented any cases of transmission in a gym, a nail salon, a barbershop, a hair salon, or a restaurant that was between employees and patrons. There have been,
Okay,
I think,
so
we try to give you as much specifics as we can.
Right, but by saying that they've visited these places, it can unfairly villainize some of those places that are struggling to come back after being shut down for so many months. If you say that 73%, I'm throwing this number out, or visited X, Y, and Z, or visited a hair salon, or visited here, without actually giving that second piece of information, which may be more important than how many of them visited those places, because the general public hears it and assumes, oh, well, it spread at a restaurant. Without that last piece, it's very important, especially to these small businesses, to get the word out that it's not spreading in those places. Many of them have invested a lot of time and money to make them as safe as possible.
Yeah. So I think, that question about why the PADOH is reporting information that way is a question for them. I can't speak for them, and I don't have any particular knowledge of why they're doing that. We have tried to be very clear here that we are supporting all places of business that are following the mitigation measures, and that we have not seen any outbreaks associated with those particular places. Because we fully understand, and we've been saying this for months, how hard these businesses have worked to get their doors back open, how expensive it's been for them. And as long as they are complying with the measures and we have no evidence of any outbreaks there, we're encouraging people to patronize this, particularly the small businesses.
And these latest orders from the governor apply to public schools, but not private schools. Any idea why that is? Because the county Department of Health order applies to all schools in the county. So why are we seeing this? And I have asked these questions to the state. I just haven't gotten answers. So that's why I'm asking you.
I don't have an answer to that question.
Okay. And I know that I gave you a heads up on this yesterday. I wasn't sure if you had any information to share on the monoclonal antibodies, because it does seem like a little bit of hope and help on the way, especially if a Montgomery County hospital is aiding in this.
Yes. So as I mentioned before, there are some new treatments that are being approved. And what's important to know about these treatments is they're not considered cures for the coronavirus, but they do seem to be able to reduce the risk of an individual having a very serious case of the coronavirus. They help people avoid being on a ventilator. They help reduce the duration of hospitalizations. So I have not yet received specific information about which hospitals the monoclonal antibody treatment is going to, which is the newest of those new treatments. But I have heard that there's at least one hospital in the county that has received it, but I haven't gotten a list.
Okay. Just to wrap it up, I know I've asked you questions you can't get answers to, but if there's any way you can get those answers from the state, perhaps you have more pull than us, since reporters here in this section of the state rarely get called on at the public briefings and whatnot. So I would like to get that clarification, because I think that's important to people. So when you're talking to people, if there's any way you can get that answer, I'd appreciate it. And I'll see you next week at the briefing then.
Okay, thank you.
Thanks, Deanna. We'll now turn it over to Joe Savalia from the Bucks County Courier-Times. Joe,
Yes, got it. Sorry. Dr. Arkush, I was just wondering, given the rising number of cases that are requiring hospitalization and the capacity issues, is this a concern? Does Montgomery County have any plans in place? According to the latest state data today, I believe more than 80% of hospital beds they're reporting are currently occupied.
So we are meeting regularly with our hospitals, and so far here in the county, they are doing okay. But as I mentioned earlier, we are seeing very rapid increases in hospitalizations. The 9 hospitals in Montgomery County are committed to working collaboratively together, and will work to share resources here locally if that becomes necessary. And again, we're just in regular communication with them, trying to see, trying to anticipate any unmet needs and strategize about any solutions to those unmet needs. But so far, they're doing okay. But again, it just underscores the need for our citizenry to please follow these proven strategies to reduce the spread of virus in our community, because the last thing we want to see happen is our hospitals become overwhelmed.
Thank you.
Thank you.
there are no further questions today.
All right. Well, thank you, everybody. I hope everyone has just a wonderful, safe Thanksgiving. I know it's going to look a little bit different this year, but I just want to say that I'm thankful for everyone out there that's working so hard to help protect our community, and how grateful I am to our staff here in the county, many of whom have not had a day off in 38 weeks. And I just want everyone listening to know how fortunate you are to be served by this amazing group of public servants. And want to thank everybody for that work, and wish everybody a safe and restful day on Thanksgiving.